Hello everyone, my name is Polina and I'm a content strategist at CAM Vision. Today we're going to speak with Nadine Wiesmann and Jonas Eckrich, and let me introduce them. So, Nadine Wiesmann works at the Department of Otorhinolaryngology, that was a success in pronunciation, head and neck surgery at the University Medical Center of the Johannes Gutenberg-University Mainz. Nadine does research in cancer, cell biology, material science, and molecular biology. Jonas Eckrich is affiliated with the Mainz Lab of Otorhinolaryngology and also works as a senior physician specialist in otorhinolaryngology at the St. Elizabeth Hospital Hohenlind. I hope the last one was pronounced correctly. Perfect. Both have been doing research together since 2015 and have published various papers in the field of microvascular research and tumor research using the Chorioallantoic Membrane Assay, as well as other angiogenesis focused models. And today we're going to have a short discussion about CAM assay and its applications in vascular research. So let's start with some first easy introduction into the whole topic. As I understand, the CAM assay is a versatile tool that can be used to study a wide range of vascular processes. What are their current applications of their CAM assay?
Well, we have two main areas where we use the CAM assay. This is, on the one hand, the tumor biology. So we use human tumor cells to grow tumors on the CAM, and then we study their invasiveness. We test different therapies and also test the angiogenesis, so the angiogenetic potential of different tumor cells. And our second topic where we mainly use the CAM assay is biomaterial research. So we test different biomaterials for their biocompatibility and, depending on the application, their pro or anti-angiogenetic effects. And in both those topics, we have quite a focus on the microvasculature. So we check whether small vessels grow towards the biomaterial or towards the tumor cells.
And as Nadine said, we're doing research basically on both tumor vasculature as well as in the context of biomaterial integration. And well, when we talk about drug application, we're talking about drug application in a topical manner sometimes, especially with biomaterials. That's often very important. But we also do IV therapies where we put the drug directly into the vascular system and then monitor where it's going, how it's going, and which effects it has on the microvasculature, as well as where for example, nanoparticular drugs are ending up in the end. So we just fluorophore-link the substances and then monitor it after dissection of the embryo afterwards. Obviously, we are monitoring a variety of vascular parameters like the functional vessel density, vessel length, vessel diameters, and as well as perfusion rates, and also the vessel leakiness is something we've been looking into quite recently.
Okay. As I understand, it all requires certain imaging techniques. What techniques do you guys use?
Well, we use a variety of imaging techniques for the tumor as well as the vasculature. Obviously, there's just photography for monitoring of the diameter of the tumor, and also in vivo microscopy, which we do quite excessively. On the other hand, we found out that especially if you monitor the tumor size and the tumor growth over time, that just seeing the tumor two-dimensionally is very limited, because the tumors grow in a three-dimensional fashion and just ingrow into the CAM as well. And obviously, when just looking on the tumor from the upside, it's not really possible to show that aspect. So we've included ultrasound imaging in our monitoring protocols, which we do repetitively using saline solution, sterile saline solution as a conductor for the ultrasound. And we were able to monitor the tumor size in a three-dimensional fashion over time, which has granted us with some success in just being able to monitor the tumor size without the the co-founder of the ingrowth into the CAM, which is quite important from our side.
Mm-hmm.
Well, of course, a classical way to do this is to dissect a tumor or also to dissect a biomaterial and do some immunohistochemistry.
Mm-hmm.
There we can then fix it and stain it. But the problem with tissues from the CAM is that we really have a limited access to antibodies that work in chicken tissue. So often we have problems to assess the blood vessels or other markers in this tissue by immunohistochemistry because many antibodies do not function in chicken tissue. So mostly we then switch to in vivo fluorescence microscopy to monitor blood vessels because this is quite suitable if we do not have an antibody to stain it in the immunohistochemistry. And we then can do over time different images, and we do not have to focus on endpoint measurements.
Okay. I believe quite many researchers experience different issues. What imaging techniques would you actually advise to use?
Well, we use a lot this in vivo microscopy, and there we really think that standardization and the documentation is really important because with the eggs we deal with an embryonic system, so it can be quite sensitive to environmental impact. So we have to make sure that we handle the eggs in a reproducible way and that we also assess the properties of the vascular in a reproducible way to get a really good output when we use these techniques.
And obviously, with every technique we use, I mean, just the application of fluorophores, we found out it just gives us a broad range of applications. I mean, there are different fluorophores for many jobs in that regard, and it just allows to address a lot of features of the microvasculature in the system. And it's basically, well, we've not found a limit yet in terms of what we are able to show in the CAM assay. And obviously, another feature that has really helped us to step forward is just the use of new technology for the analysis, which just is so much better than just standard in terms of standardization and of time efficiency of the system.
Okay. When you talk about new technology, do you mean AI tools? And if yes, then how can this be helpful?
Yeah, well, yes, definitely. The AI tools have been a big help to us. Just microvascular analysis done by hand is a really time-consuming process, and it also bears a high risk of a high inter-rater bias, since you have to identify the vessels and you have to basically detect them all on your own, which takes hours. Especially if you have large images, you can somehow circumvent that problem by using regions of interest instead of the whole image. But obviously, that makes the sample size a lot smaller than using just big images with lots of vessels. On the other hand, it's still a very time-consuming process. So I and a lot of doctoral candidates have spent hours in the lab just trying to identify the vessels. And we found out that with AI-based systems, this is just so much more time efficient, and also you just exclude a lot of the bias, since you didn't have basically no inter-rater variability anymore afterwards.
I also believe the life quality of the researchers increases in this case,
definitely.
when you don't need to spend hours and hours in front of their images, the computer, and so on and so forth. Okay, definitely. Understandable. So from everything what you explained right now, I see that the CAM assay plays an important role in their research, and there is definitely an advantage over other animal models. As I understand, it's not only the low cost of this technology, but also their ethical acceptability. I have a question: if you have any predictions regarding the use of the CAM assay in the future?
I think the relevance of the system will still increase because it's very cost efficient and it has a broad application range. And you already mentioned that also the ethical aspects are here relevant. We have an increasing public awareness of animal rights, and most research do not really want to continue with the classical rodent models because of the costs, but also because of the 3R principle we stick to reduce and to refine and to replace the animal experimentation. So the CAM model is really a nice way to answer certain questions without rodent models, especially in the angiogenetic research.
Yeah, also the quantitative output is a completely different story. I mean, the time it takes to do similar research using other models, which we have, is just so much less compared to the amount of CAM research you can do in the same amount of time. So that is really beneficiary in terms of the system itself.
Okay. Yeah, definitely sounds like that CAM Assay is a powerful tool for the research and for the future. And I hope that we're going to be continuing making this research all together and assisting each other. So thank you very much for this discussion. That was really fruitful. I also managed to learn something new today for myself, and I hope our listeners do the same. Thank you so much, guys.
Thank you so much.
Thank you.
Us.